Greetings. Welcome to Caregiver Chronicles, Friday Night Live. Ask Dr. Yvette anything. Let me just tell you a little bit about Caregiver Chronicles so we can get started. Caregiver Chronicles is a 16-module online course related to caregiving, and it covers all areas of caregiving from the onset of your loved one's illness all the way until they recover from that illness or until they transition home to be with the Lord. So tonight, we have a special guest. We have Dr. Serena Liu, who is a physical therapist that is joining us tonight. And our topic tonight, of course, is physical therapy. Let me just tell you a little bit about Dr. Liu, and then I'll introduce you to her and she can say hello. Dr. Liu is a doctor of physical therapy. She has spent the last 5 years working with the older adult population and has realized that even though we are all experience normal age-related changes as we get older, there are ways to combat those changes. She's on a mission at this time in her life to share her experience and knowledge about how to control the changes that we all face as we grow into our senior seasoned years and we grow gracefully. So Dr. Liu, I want to thank you tonight for joining us. You can unmute yourself if you will. Okay.
Yeah. Thank you for having me. Pleasure to be here.
Thank you. So we have several areas we're going to talk about tonight. And I think it's important that we talk about physical therapy because 9 times out of 10, whenever we face an illness or some type of, negative things going on in our body, then we need to have some physical therapy because we need to keep moving. We need to keep physical so that our body can continue to, move forward. So at this time, I just wanted to ask you, just tell us a little bit about physical therapy, or if you want to talk about your background, then we can start with that.
Yeah, definitely.
Thanks.
So a little bit about kind of what I do or what I've been doing. I've been a physical therapist for the past 5 years, and I've mostly worked with the older adult population. So I would say, mostly 50 plus. And I've had experience working in a skilled nursing facility. And so this is an area where you might have, a loved one go to the hospital and they spend some time there and they're not quite ready to go home yet. And
Right.
so they get sent to a skilled nursing for more rehab until they're ready to go home. And so I worked in that setting quite a bit, and that's, very important for, when you have any sort of medical condition, if you have a fall, a surgery, and you need a little bit more rehabilitation. And then currently I'm working at an independent living facility, so providing services to a little bit more of an active community, helping them stay as independent and safe as they can. So yeah.
Okay, sounds great. So I actually have worked in a skilled nursing facility as well. And I know in that facility, they had a large room with all this type of equipment for the patients because it's important that, they keep them moving as they recover in that facility. And so you're actually the therapist there in the skilled nursing, right? Or you said, is it an assisted living or a skilled nursing facility?
It is both. So there we have like maybe 10 or 15 residents that are staying there permanently, and then the other like 50 are short-term residents. So short-term just for rehab.
Okay.
Yeah.
All right, good. All right, so let's talk a little bit about physical therapy versus exercise. Is there a difference or are they one and the same? Because I think that's important to understand.
Yeah, so I would say there are a lot of similarities. We definitely do exercise in physical therapy.
Okay.
However, the difference would be that with when you're working with the physical therapist, you're generally working to work on improving certain impairments that you might have. And so this will be different for everyone. And so the therapist will do an evaluation and test your range of motion, your strength, your coordination, balance, endurance, all these different things to determine what limitations you might have specific to you. And then they will come up with interventions to help address these specific impairments. Whereas exercise is kind of, just any sort of physical activity that you might do.
Oh, okay. So with the physical therapy, an assessment is done specifically for that person, and then
Mhm.
that therapy is based on what that person's ability is and moving them to another level of physical agility, if you will, so that they can,
Yeah.
function in their environment. And now, as far as exercise is concerned, it's like it's not an individualized therapy per se. It's
Hmm.
more like we could have a group exercise, like you can do Zumba and that type of thing. Is that correct?
Right.
Okay.
Yeah,
Okay.
exactly.
So as far as the ailing and geriatric population is concerned, I know that physical therapy is critical for them, especially as we become more seasoned because, our bodies are changing. We're not able to move as we have in the past. And so what are some of the challenges that you face when you have the patients who are aging and, moving into their senior golden years?
Yeah. So I think the biggest thing is that, and this is something that we'll all experience, is just that we have these normal age related changes. So,
Right.
we'll have a decrease in strength, decrease in endurance, decrease in power, coordination, all these things that happen as we age. But there is a lot of literature out there that supports that exercise is a great way to defer or even combat these changes. And so I would say staying active is the number one thing that we want to be doing as we get older.
Mhm.
um, and it's never too late to start. So even if you haven't been very active, and now maybe you're in your 60s and you're starting to feel you can't quite do the things that you used to be able to do.
Right.
It's not too late to start. You can still build muscle mass, increase your strength and endurance no matter what age you are. So
Yeah.
I think that's really the big thing there. um, yeah.
Okay. Okay. So it sounds good. So as you said the age of 60, and I was like, you're touching in my territory when you say that. I'm like, okay, 60, we can still get moving. But
Yeah.
I know that I think as we become more seasoned, and this is for some people, not everybody, because most people some people exercise throughout their whole life, and then some people start exercising when they realize they have some type of deficit, and then some people do it when they have to do it because they're at a
Mhm.
point where their ability to ambulate is in jeopardy, and so that's when they start doing it. So that's really good. Now, what about the relationship between movement and pain? I think you had mentioned something about that because pain is a situation where it can determine how we're going to move forward. Because if I'm in pain when I start doing exercises, 9 times out of 10, I'm not going to want to do it, or I'm going to need to take some type of medication in order
Mhm.
to, alleviate that pain or lessen the pain. And I know that working in a skilled nursing facility, as I have, when we had a patient that was in pain and they were going to do their PT, they would give them their pain medication before, maybe like an hour before their therapy, so that way they can kind of be able to get through it and the pain wouldn't be so to the point where they couldn't handle the therapy because of the pain. So
Right.
you want to chat a little bit about that, if you will?
Yeah, yeah. So in terms of like a skilled nursing facility stay, if someone's having pain
Mhm.
because they just had surgery, so that's one thing, and that's kind of a temporary pain. And so we definitely want to, pre-medicate for those types of situations. And then we also have more of the chronic pain. So if someone's been, having chronic knee pain or back pain, it gets pretty hard to move, especially if you're unsure if what you're going to do is going to exacerbate that pain. And
Right.
so I think a really important thing is if you or a loved one are experiencing pain is to kind of catch it early on and not let it become chronic. Seek out, a physical therapist or a movement expert to help kind of identify what the root cause of that pain is, and provide some education on pain, because we've come to understand that it's a very complex. Pain is can be an experience,
Right,
and
right.
we can start to associate that with specific movements or events, and so catching it early is, I think, a big part of it, and then making sure that you're understanding what's causing your pain, and
Right.
understanding what the right movements are to do for you, so that you can learn that movement is okay, and start to progress that movement, so that you can incorporate more and more movements without pain.
Hmm. Hmm. When you were talking now, I just, what I just thought about was atrophy, because atrophy is a very big thing that happens when we get to a point where we're in our last, and getting seasoned, and we're at a point where we may be, elderly, we may not be walking as much, we may not be moving as much. And then when you get atrophy, I guess you're not able to move certain limbs. They get stuck in that position. Is that correct to say? Is that safe to say?
Yeah, so I would say, if we, don't use our muscles, they'll definitely start to get weaker, and especially if we're not moving through certain ranges of motions, then we can start to lose that length, the ability to move through those
Right.
motions. So,
Yeah.
yeah.
Yeah, that's something. I've seen a lot of that where they have the atrophy and they're contracted. They call it contractions,
Hmm.
where you're, and if you don't know what I'm talking about, those who are listening in, you get to a point where your arm is stuck in a one position and you can't straighten it out or make it flat, make it out, make it straight. It's called atrophy, and it's really something. I guess it's contractors. Is contractors and atrophy, they're the same? Is that correct?
So atrophy would be like your muscles getting weak, and then
Right.
a contracture would be uh, you're losing the motion in a joint due to tightness in a muscle.
Okay.
So
So contraction
um,
is the joint area
yeah.
where the joint won't move. Is that right?
And that's due to tightness of the muscles.
Okay? So the atrophy is the muscle, the contracture is the joint. Is that
Yeah.
okay? All right. I'm just trying to make sure I'm saying the correct thing here. Okay, good. Thank you, Dr. Lou. So, what are
Yeah.
some of the things that you would suggest? And we're going to go to the other topic, but I want to talk about this first. Some of the things you would suggest for a person who, is experiencing some pain, or they just, they don't want to do much because it's so painful, or they just, sometimes people just don't want to and they don't do.
Hmm.
But what do you suggest for those individuals? I know they have some exercises that are, or some, therapy that's a little more low impact or high impact or that type of thing. Can you kind of talk about that a little bit, please?
Yeah. So if someone is having pain and they're, a little bit afraid to move because of that pain, I would say it's just about finding the movements that don't cause them pain. And so, whatever that may be, and that might be a trial and error,
Right.
but just kind of closely monitoring them, and, always asking, how did that feel? Was that painful? And then you find the movements that don't cause pain, and then we can start to do those movements
Mhm.
and build up strength. And then we can progress and, increase the motion just a little bit to see if they can tolerate that. And then it's just kind of a continuous process there. And then for the people that aren't too motivated to exercise,
Mhm.
a lot of times it's just about kind of finding things they're interested in,
Okay.
and kind of making the exercise geared towards that. So you can if someone is really interested in, let's say, like boxing, we can kind of do kind of boxing moves, or they really like dancing.
Right.
You can kind of be
Dancing
incorporate
is
some
a
sort of
lot of
dance,
fun.
play some
Yeah.
music,
Right. Right.
but just finding what, inspires them and makes them happy and they're really interested in, and then incorporating the exercise with that.
Okay. Okay. That sounds really good. Okay. Yeah, because if you get them to dance a little bit, they might want to do the little exercise a little more. So
Yeah.
that's great. That's great. Okay, so now physical therapy with specific diagnosis. Now, and before we say that, I was thinking about religious beliefs. Or have you heard of any religious beliefs that will interfere, not interfere, but will stop a person from doing specific types of therapy? Have you heard of any or encountered anything like that in your career at this point, Dr. Lou?
Yeah, so I can't remember off the top of my head the religion,
Mhm.
but I remember it was a religious reason, but someone, was very anemic and they needed, blood transfusions, or they were recommended blood transfusions, but because of their religion, they were refusing them. And so,
Mhm.
we couldn't really work with him, and it wasn't safe to work with him because of that. But
Mhm.
that, we had to respect his wishes. And so
Uh-huh.
that's the only incident I can really
All
think
right.
of.
So the religion that reflects not getting blood transfusion is Jehovah Witness. That's the religion
Yes,
that,
yes,
yeah, they
that's the one.
don't believe in blood transfusions. So you're saying you had a patient that needed a blood transfusion and he couldn't do the therapy because he needed that transfusion?
Yeah, so they were saying that they didn't want us to work with him because his blood cell level counts were so low, and
Uh-huh.
so they they said, yeah, that it wasn't safe for us to work with him.
Hmm. Okay.
Yeah.
Wow, that's something. So he needed his blood count needed to be higher so that his
Hmm.
body can handle the actual exercises that you were going to do with him. And because of his
Right.
religious belief, he wouldn't do the transfusion. Do you know what happened with
Hmm.
that patient? Did he end up, did he
Um, so I know eventually, like during his stay,
uh-huh.
they did return up to, a normal level, and so we were able to keep working with him
Okay.
once they did return. But then, long term, I'm not sure.
No,
Once he left, yeah, he left to go back with his family, and then
right.
yeah,
So he did get his blood level up and then he was
he
able
did,
to do the exercise. So
yeah.
his blood level being low, would that make him prone to maybe like just kind of weakness? Is that what it was? Was he not strong enough to do the exercises because of that?
Yeah.
Oh,
Yeah. So weakness and I think just, not wanting to, having him exert himself and cause those numbers to drop even more.
oh, okay. So that would use up his blood. His blood wouldn't rekindle itself, if you will.
Yeah.
So that, oh, okay, okay. So yeah, because I always want to include, because I know the religious areas have a profound effect on what we do in our lives. And so I just wanted to bring that in as well. So now
Hmm.
physical therapy with specific diagnoses. Now I know that a lot of people in this day and age are having knee replacements, they're having hip replacements, they're having a lot of replacements, if you will. And so, how does that work when you have a patient? Because I've kind of had some work done myself, and when I thought about it, I said, well, now I was thinking about my experience with the physical therapist. So I would go see this therapist once a week for my therapy, but she gave me a lot of exercises that I needed to do myself. And because I
Hmm.
was determined to move forward, I did probably more than she thought I would do because they told me that if I didn't get to a certain level, that I wouldn't have my other procedure done. And so
Hmm.
I what I did was I made she was shocked that I did it, but a lot of times it's motivation because if you want something, you're motivated to
Hmm.
do it. So I said that to say that it was a great experience because I had to have a physical therapist at one time myself. So I go to see her once a week. She would provide me with the exercises. I would get on the equipment. They had a bike and they had this like bars you can hold on to, and then you walk on those bars and
Hmm.
all kind of things. They just had a whole room of equipment that I could go through and do whatever, but she would kind of guide me and direct me. So when you have specific diagnoses and you're dealing with physical therapy, how does that work? Do you have to, I mean, is there certain things you have to, I know you have to communicate with the doctor because you want to make sure that your therapy is complementary of what the doctor wants for the patient. Is that correct?
Yeah. So right now we actually have direct access. And so if someone did want to come see a physical therapist, then they could just kind of come in and work with the therapist, and the therapist would be able to do their assessment and evaluation and determine if, therapy is right for them or if they need to refer them to someone else or to a doctor.
Uh-huh.
And so we have that. And then a lot of times we do get doctor referrals. So doctors kind of seeing the patient and then sending them over, and then recommending interventions for us to do. But at the end of the day, we're doing the assessment and kind of figuring out what their impairments are there, and then tailoring the treatment plan to them. And then that usually gets sent back to the doctor, and then they'll look over it and sign it off. So yeah, there's definitely a close
Connection.
working connection with
Right.
the doctors and
Doctor.
making sure we're all on the same page.
Okay.
Yeah.
Okay.
But in terms of specific diagnoses,
Mhm.
Like I said, through the assessment, that's where we kind of find a lot of the impairments and what we need to work on. And so even if someone's coming in for, let's say, a knee replacement,
Okay.
and you could have two different people come in, and their exercises and their treatment plan might look pretty different, just kind of depending on where they're at in their recovery. Some people recover a lot faster than others,
Right.
and their age makes a big difference too.
Mhm.
And so
Even
we
their
just
body, even their body makeup, like if they're depending on what their weight is, is that
Yeah.
can have an effect on it too, right?
Yeah, and then their general health, if they have other comorbidities and things like that. And so, we just tailor the treatment plan to that person. So it's very, very individualized.
Mhm. So when you talk about comorbidities, for those who are listening in, comorbidities means that you have several different chronic illnesses. Like you may have diabetes, you may have high blood pressure, you may have end-stage renal disease where you're on dialysis. Those are considered chronic conditions. So I just wanted to bring that up. And if anyone is listening in, you can type it in the comment or the chat, your questions or concerns, and we'll be happy to respond to you. And also, if you want to get in touch with Dr. Lou, if she's available, then you can also type your information and what question you have, and I'll make sure she gets it. Okay. Okay, Dr. Lou, so I wanted to put that in right quick. So now, pelvic health, that's kind of a unique term. Can you kind of talk about that a little bit, what that means?
Yeah, definitely. So there are therapists that specialize in pelvic health. I'm not one of them, but
Oh, okay.
there are some fantastic therapists that really specialize and focus on that area of the body.
Okay.
And so
Are they physical
essentially,
therapists also?
yeah,
Oh, okay. So they have specialties within physical therapy.
yes, yeah.
That's the next topic. We'll talk about that next. Okay.
Yeah,
I
sounds
didn't know
good.
that.
Yeah, we'll go into that.
Yeah.
So basically, as we get older, something that your loved one or someone you might know might experience is incontinence, and also just kind of having difficulty, either voiding or having some leaking, or not making it to the bathroom in time. And so all these things can be helped by seeing a pelvic health physical therapist. And so you have, a bunch of muscles kind of in that area that help to contract and relax, hold your bowels and your urine in and help you to excrete them at the right times. And so sometimes, those muscles get weak, or sometimes they get too tight, or they just don't kind of fire at the right times. And so that control piece of it isn't there. And so what a pelvic health physical therapist could help you do is figure out which, muscles need to either get stronger, or maybe they're too tight and they need to get released, and kind of work with you on getting better control of, going to the bathroom. And that's a big thing, a big concern too, because a lot of falls can happen that way. So, someone rushing up to go to the bathroom because, they just get this quick urge to go and they can't hold it in. And so they're rushing and not taking their time. And then a lot of times that leads to a fall. And so making sure that, that is addressed can be a way to prevent falls from happening.
Oh, okay. Okay. So I never thought about that, where they had specialties within. So within physical therapy, there are various therapists who work with specific, would you say, parts of the body or specific things, or how would you portray that?
Yeah. So we go to school and we kind of learn it all. And some people, they kind of dabble in everything and can, know a little bit about everything. And some people like to really focus in and hone in on, one area. So, there's pediatric physical therapists, so they work with kids.
Mm-hmm.
And then we talked about pelvic health, and, there's kind of like more sports-based therapists working with athletes.
Okay.
And then, I focus mostly on, geriatrics and the older population.
Okay.
And then, some therapists do like to specialize in a body part. So, shoulder, knee,
Okay.
back. Yeah. So you can kind of pave your own path and, choose what you want to specialize in, what really interests you, and what you want to, really become an expert in and get to know more in.
So when you're going to school for physical therapists, you would determine at that time, I mean, so do you get an overall education about physical therapy, but you also can have a specific specialty? Like,
yeah.
Okay.
And one of the ones I didn't touch on, I just thought of is, working kind of more with the neurological population, so traumatic brain injury, strokes,
TBI.
brain injuries. So you go to school and you get, just kind of a general degree, and then you have to pass, your boards, and that's just kind of a general board examination.
Right. So it's general, okay.
And then you can take a specialty exam. And so like I'm going to take my geriatrics specialist exam in March. And so that's just kind of another way to kind of like solidify your understanding of that specialty.
Mm-hmm. So you're gonna have a specialty in geriatrics, which means basically everything, because the body starts to deteriorate at some point. And so if you are going to be a geriatric specialist, then you're going to basically deal with the whole body. Is that safe to say?
Mm-hmm,
okay, that's
definitely
great. That's great. All right. So now, PT and vital signs. I know that a lot of times, sometimes I know that if a person's vital signs are not stable, then you have to kind of be careful of that too. You want to touch a little bit on that?
Yeah.
Oh,
so,
and talk about COVID-19, because that's a big issue now too. We'll get to that. Okay.
Yeah.
Go ahead.
Sounds good.
Thanks.
So we can talk about heart rate first. And so, kind of general resting heart rate, we like to see, between like 60 and, maybe 80 on the higher end.
Okay.
And then with exercise, so there's a kind of formula we like to use to calculate what someone's maximum heart rate should be when they exercise.
Mm-hmm.
And so you're going to take the number 208, and then you're going to subtract 70% of your age. So that number will tell you, kind of what your max heart rate should be when you exercise. And so, as we're working with someone, we're kind of monitor them, see what their heart rate is, and make sure that, we're not going over that. And then another great way to kind of assess this is something we called a rate of perceived exertion chart. And so it's this chart, and it's kind of like 0 to 10 And then 0 would be, resting, you're sleeping in your bed. And 10 would be the hardest you feel like you could exert yourself. And so they could rate themselves on that scale after an exercise to kind of let you know how hard they're working. And so they found that that chart correlates pretty well to kind of the intensity that you would want them to be working at.
Okay.
And so for blood pressure, we don't want to go over 220 systolic. And so that's from the high end. And then on the low end, sometimes people have hypotension. So that's a drop in blood pressure. And that's usually from a change in position. So if you're going from laying down to sitting up, or standing up from a seated position. And so that's something we want to monitor, and that will show up as like I'm feeling really dizzy, kind of like the room is spinning, and you can kind of tell in their eyes too. If you look closely, they have a hard time focusing. So that's something else you want to monitor for as well when you're working with someone.
Okay, right. Because I know working in the nursing home, a lot of times they would assess the patient, and if the patient's levels were not proper or in the right range, they would not work with them because of it, because it could, the pressure could drop, it could get too high, or for whatever reason, they had to make sure that that particular patient had a specific range so they can work with them and not worry about any, other things happening, if you will, or other onset of anything while they were working with them. So they have to be very careful in the nursing home and in that environment when you're working with the patient. I know that. Okay. All righty. So now let's talk about our new normal, our COVID-19, because that has changed the trajectory of this world. And so what has it done as far as the physical therapist perspective is concerned?
Yeah, so I think what we're starting to conclude is that, the healthier you are or were before, if you did contract COVID, right, the better you are at being able to, recover from it. And the people that tend to, have that tend to be affected more significantly do tend to have more comorbidities, like we talked about. So,
right,
like obesity or diabetes,
right,
things like that. And so, I think the key thing is, the healthier you can be, the more active that you are, then, the better off you will be when, we have these very, very intense, viruses going around. Yeah.
So how are you protecting yourself, Dr. Lou? Because that's a big thing too. The medical professionals are at risk, high risk. And I'm going to say this to you, and you don't know this about me, but in January, I was working before the new year, or right at the beginning of the new year. The January 2nd was my last day working in the nursing home. And I didn't know the pandemic was coming, but I'm thankful that I had made that adjustment, because you never know what could have happened. And as medical professionals, and I'm a licensed clinical social worker, as a medical professional, being in a nursing home and working in the health environments, it puts us all at risk. So how have you been, making sure that you're protected and, protecting yourself? And I'm probably working you extra because of the pandemic too, probably, right? So
yeah.
Are you taking care of yourself, Dr. Lou?
Yeah, so definitely, always wearing a mask. And then we also have like these face shields that we wear. And then the
clear shield you can see through.
Yeah.
And you wear a mask too?
Yeah, so we wear a mask, the shield, and then the patients are also wearing a mask.
Okay.
So yeah, and then we've been doing a little bit more, in-room treatments versus coming to the gym unless it's something that's like really necessary, just to kind of minimize that, contact of touching things. And but when we do, we sanitize. So we have these wipes that we use to wipe everything down. Um, and then, yeah, so it's also, patient preference. Some people, don't want to go to the gym, even if it might be good for them. And so we kind of just adapt and do the best we can in their apartments.
Okay.
Yeah.
So you have apartments where you are, and you have apartments there more so than like rooms where people are in like hospital beds, right? Is that correct?
Yeah.
Okay. So you would go to their apartment and see them in their unit as opposed to
Hmm.
them coming out to to the general area where the equipment is. Okay.
Yeah.
So that cuts down on it. Did you guys,
Hmm.
and I don't know if you want to answer this, you may not. Did you guys have any situation with the coronavirus at your facility?
I think we've had like some staff
To,
from what I've heard, yeah. And then, they go on quarantine once that, they find out that they have it and can't return until they go through the protocol. So,
right, right. Get
yeah, but
clearance.
no residents so far. Fingers
Oh,
crossed it stays that way. Yeah.
well, that's good. That's really good.
Hmm.
Okay, okay. All right. So then the next topic, and it's probably the last topic we'll talk some more about, but physical therapy and telehealth. Is that possible? I thought about it. I said, is that possible to do physical therapy and telehealth? Because everything's telehealth. Now, I do telehealth. I work in a prison, and
Yeah.
we do video conferencing with the inmates. And so,
Yeah.
everything, the doctors do it. Most things are going telehealth now. So how's that working for the physical therapy when you're always hands-on with the person?
Right, yeah. So I personally don't have experience with it, but I've heard a lot of great things about it. Um, there is a lot of hands-on with physical therapy, but there's also, a big part of it is like you were mentioning before, having that motivation and, being more self-reliant to do the movements and the exercises to get those outcomes. And so I think it's kind of shifted a little bit into more of like this education role where, we're, telling someone, what's going on and what they can do to help it. And, it's up to them. The ball's in their court to do that. Um, and in terms of, like assessment and things like that, kind of have to, modify and get creative with it. But, there are ways to kind of do those assessments and kind of see how they're moving and things like that, and come up with kind of where their impairments are. So yeah, it's definitely different, but I think it's been working out, and a lot of people have liked, not having to drive to the clinic, being able to be seen more quickly, and so they're not having to wait, for 2-3 weeks if the clinic's all booked up and things like that. So there's definitely a lot of pros to it.
Okay. All right. So wow, that's good. That's good that you can do the physical therapy telehealth. And it's just, I guess, kind of telling them what to do while you're, communicating with them virtually, you know.
Yeah, and then we can watch them do the exercises in their environment, which was always nice because someone can come into the clinic and do some exercises, but if they aren't able to modify that and do it at home, then that's an issue. And so the nice thing is that they're already in their home, so they can kind of show you what they've got to work with, and then you can make recommendations based off of that. And they can also kind of show you like, hey, when I do this, I have pain, or this is hard for me to do, and it's in their environment, in their home. And so that's another really nice piece of it.
Right, right. Okay. All right. So that was our last topic, but I want to just talk a little bit about just you as a physical therapist. What would you suggest for someone who has a caregiver? Because basically what we do we deal with caregivers, more so. Caregiver Chronicles is an online course for caregivers, and it walks them through step by step every aspect of caregiving, from the onset of the loved one's illness all the way until they recover or transition. So for a caregiver, how do you deal with the caregiver? Because a lot of times the caregiver is going to be the one that's there with the patient, and they're motivating the patient to do certain things and to, make certain adjustments. I'm sure you've had that instance in your work. Um, can you talk a little bit about that and how that works for you with the caregiver? Because that's the main person, I would think, other than the patient.
Yeah. So if I were a caregiver, I would want to try to, and if, the person that you're caring for is receiving physical therapy,
Yeah.
I would, try to sit in as many sessions, as you can. It's a little hard right now with the pandemic going on, but, really, asking the therapist, how they're doing, what are certain cues or techniques that you use that really help them move, because some people they respond really well to one thing versus another, and then kind of asking them about the safety piece of it. So kind of asking them like, what's the safest way for them to get up and use the walker, and just trying to educate or learn as much as you can from the therapist. And so like sitting in a session would be a really good way to do that. And also if you are able to right now, be a little hands-on with the patient while they're in therapy, so that the therapist can see and kind of observe how you're, helping them transfer or working with them, and then provide you with feedback there, so that you feel really good and comfortable working with whoever you're caring for.
Right. Okay. All right. So that's great. That's great. I just wanted to bring that up because that's important. So now, basically, therapy is important. It's critical, from the caregiver's perspective as well as the patient. And so at this point in time, just want to thank you for joining us, Dr. Lou, tonight. Therapy is a critical piece of us. It's a critical piece of our learning. It's a critical piece of our growing forward and moving forward in our lives. And so I just want to thank you for joining us tonight. If you have a question, if you want to reach Dr. Lou, or you want to reach myself, please email me at caregiverchronicles247@gmail.com, or you can go to the website, and that's www.caregiverchronicles247.com as well. And then we'd be happy to respond to you. Dr. Lou, is there anything you want to say to the audience that's listening in tonight?
No, I think that was a great conversation.
Okay, great. All right, so that's it then. Thank you so much for joining us. We look forward to seeing you next week on Caregiver Chronicles. Ask Dr. Yvette Anything, Friday Night Live. God bless you. Thank you, Dr. Lou, and I will see you in the therapy. Bye-bye.
Okay, thank you.
Bye-bye.